8, Dr. Paul Hutchison.
Thank you. Speaker, to the Minister of Health, what reports has he received of improvements to frontline emergency ambulance services?
The Honourable Tony Ryle.
Mr. Speaker, members may recall that the government invested an extra $48 million over 4 years for ambulance services, including 100 extra paramedics. I'm pleased to advise today that almost half of those 100 paramedics have started work and the rest are on track to be recruited this quarter. This is already making a significant impact on ambulance services, especially on the ability to have double crewing for call-outs in some areas. For example, the additional paramedics, DHB is now able to operate the Greytown station 24/7 and staff are able to take well-earned leave.
Dr. Paul.
Supplementary. Thank you, Mr. Speaker. To the Minister, what other improvements to frontline ambulance services can the Minister report?
Honourable Tony Ryle.
Mr. Speaker, yesterday my colleague Nathan Guy and I attended a celebration of care closer to home in Kapiti. On the Kapiti coast, Wellington Free Ambulance has halved the number of hospital admissions on their call-outs. Their paramedics assess patients at home first and treat them on the spot if that's appropriate. Wellington Free Ambulance's 24/7 treat at home urgent community care pilot, funded by this government, has seen 1,161 Kapiti patients and only admitted 399 of them to hospital. That's a drop from 75% hospital admissions to just 34%. Over half of those patients are over 75.
The Honourable Ruth Dyson.
How many more elderly will need an ambulance following his decision to strip more than 3,000 people in Southland and Otago of their home help?
The Honourable Tony Ryle.
Mr. Speaker, as I've been assured by the district health boards that no one will be left unsafe in their home, but I've also been advised by the Otago Southland District Health Board that during the time of the previous government in the last 3 years, there were actually hundreds of people in that area who had their home care stopped. There'll be more information on this in question time later this week.
The Honourable Ruth Dyson.
How many more people in Palmerston North and Whenua will need an ambulance following his decision to allow the 24-hour-a-day district nursing services to be scrapped?
The Honourable Tony Ryle.
Mr. Speaker, the changes that are being considered at Mid-Central District Health Board have nothing to do with the level of funding that the government has given them. The government has in fact increased funding for Mid-Central District Health Board by $26 million in the last year, and there will be more money next year. I can assure the member that there will be care available for those people in Palmerston North.
Question number 9, Sue Kedgley.